TC, Jersey Central with Burt Barron on the new Talk Radio 1450 WCTC.
It is 8:19 on Jersey Central on the new Talk Radio 1450 WCTC, the voice of Central Jersey. Good morning to you. It's Burt. Thanks for spending some time with me on a Monday. 44, some light rain. We're going to have some heavy showers possibly moving through again this morning, but we'll get you the latest traffic and weather update coming up at 8:25. Phone number 732-545-9282. And our toll-free number, 888-545-9282. Well, WCTC, as you know, is the official media partner of the American Heart Association of New Jersey and the Go Red for Women movement. And as I made the official announcement last week that I have once again been invited to be the host and MC of the Go Red for Women Luncheon. I had such a great time last year. I'm so honored to be invited back again to host the Garden State Go Red for Women Luncheon. It'll be Friday, May 11th at the Palace at Somerset Park. And if you'd like some tickets or information, you can visit gardenstategoredluncheon.heart.org. And joining me now on the Jersey Central Newsmaker Hotline with some more information on the event is the co-chair of the Go Red for Women Luncheon. Let's welcome Dr. Aliya Browne back to WCTC. Dr. Browne, well, good morning. Welcome back to WCTC Radio. How are you?
I'm doing well, Bert. Good morning. How are you doing?
I'm well, and whatever role you had in suggesting me to host and MC the lunch once again, a sincere thank you to you. It's such an inspiring and just such a powerful afternoon that I'm really honored to be a part of once again. For someone who's never been to the Go Red for Women Luncheon, Dr. Browne, what do you want people to know about it?
Well, the Go Red for Women Luncheon is set for, again, Friday, May 11th, and it's one of the premier women's events in New Jersey. We focus on cardiovascular health and wellness in women, and it's a cornerstone piece of the American Heart Association's Go Red for Women movement. This social educational event focuses attention on uniting women to prevent or survive the number 1 and number 5 killers of women, heart disease, and stroke. We've got to do more work to make sure that women understand their risk, understand that it is still the number 1 and number 5 killer, heart disease and stroke, and we can do something about it.
Yeah, and just the survivor stories, Dr. Browne, that everybody gets to hear that day. And one of the things that really inspires to me is I have a chance to talk to, everybody has their very own unique story and their own story of survivorship. And just to hear from people and what they've been able to overcome. And thanks to the great work, of course, by you and, of course, everyone at the American Heart Association, that these people are still with us. And it's such a powerful and inspiring thing that I always come away just feeling so good about things, when I have a chance to literally, hundreds of people who are there, all with unique stories. It's just such a special day for me as well. And it's the survivorship that I think I take away from this event.
Their stories are so impactful, and to be able to hear and see women that look just like you, that are younger, that may be your same age, makes a difference when we start thinking about heart disease. 80% of cardiac and stroke events can be prevented. And unfortunately, cardiovascular disease, including stroke, claim the life of women every 80 seconds. So when we see someone up there who has survived, we know that could be me. And what can I do now to make sure that I can prevent it from happening to me?
Yeah.
Those stories are so impactful.
No question about it. And as you mentioned, still the number 1 killer, which is just amazing. And it's such a different thing. Heart attack versus man versus woman is such two drastically different things. What do you want women to know? What message can we give them about potential symptoms where they need to seek immediate help because of a heart attack? Dr. Browne, what should they be on the lookout for women?
So what you said is true. When that author came out with men are from Mars or women are from Venus, something like that, we do have different symptoms. But we should also remember that chest pain is the number 1 symptom in both men and women. But women do present differently with chest pain. It may be in their back. It may be a pressure. It may be tingling down their arms or shortness of breath. Most commonly for older women, they present with fatigue. They just can't do the things that they used to do. The most important thing to do is get to your doctor as soon as possible. Or if you're having symptoms that last for more than 15 to 20 minutes, get to the emergency room immediately. Make sure you're taking care of your health before those types of things happen by making sure you go to your doctors yearly, get your total cholesterol done. Know what your blood pressure is. Make sure it's in range, less than 120/80. Make sure your blood sugar is healthy, less than 100 is normal. And make sure your body mass index is in a healthy range of 25 or less, 18 to 25.
Yep,
It's important.
all important things. You're right. And again, the Garden State Go Red for Women Luncheon is returning. It's coming back to the Palace at Somerset Park once again this year. It'll be on Friday, May 11th. We, of course, will have a nice heart-healthy lunch that everyone will get to enjoy. We'll have some speakers there. There'll be some award presentations as well. And again, just the inspiration that people will come away from this is just remarkable. If you'd like some more information, you can visit gardenstategoredluncheon.heart.org. It is locally sponsored by Bristol Myers Squibb, nationally by Macy's and CVS Health, and 1450 WCTC, this radio station, once again honored to be the official media partner of the American Heart Association and the Go Red for Women Luncheon. Dr. Browne, thank you as always for the time this morning, and I can't wait to catch up on May 11th. And thank you for the work you're doing for women here in New Jersey, all right?
Thank you, Bert.
All right, thank you very much. All right, and again, the website.